Hello, everyone. Welcome to another special assessment for our CAA students. We're still on basic anatomy and physiology, and today we focus on the urinary system. Let us call on Sir Rodrigo Maliksi of Samal Island. Good afternoon, sir.
Good afternoon, Doc.
Let's get on with the assessment. What are the functions of the urinary system?
The functions of the urinary system are we have two functions. Like number one, removal of waste from the blood. Then number two, transports, stores, and eliminates the urine.
What organs will comprise the urinary system?
Uh, we have kidneys and ureters, the urinary bladder, and the urethra.
What is the functional unit of the kidney?
The function of the unit of the kidney is there are 1 to 1.5 million nephron units in each kidney.
How is the glomerular filtrate produced?
The blood pressure within the glomerulus forces fluids and solutes from the blood into the glomerular capsule about 180 liter per day.
Describe the composition of the glomerular filtrate.
It is similar to plasma except it has less protein.
What is the GFR, or glomerular filtration rate?
The amount of fluid filtered from the blood into the glomeru- glomerulus per minute.
What factors influence the GFR?
Net filtration pressure or the NFP, the glomerular blood pressure, the blood osmotic pressure plus the capsular fluid pressure, uh, permeability of filtration membrane, and surface area of filtration membrane.
Describe the mechanisms by which the GFR is controlled.
Uh, A is autoregulation, decrease BP or decrease GFR, and decrease GGA, dilation of the afferent arterioles, increase NFP, increase GFR. And B is hormonal, decrease BP and decrease GFR, increase the GGA and renin, converts angiotensin one into angiotensin the second, which number one constricts efferent arterioles, increase NFP, increase GFR. Number two, increase adrenal cortex. Then the aldosterone increases sodium and water retention, increase the BP and increase the GFR. Then number three is increase the thirst center in hypothalamus, then increase the fluid intake, then increase the blood volume and BP, increase the NFP, then increase the GFR. Then number four, increase the posterior pituitary, the ADH, increase water reabsorption, and increase blood volume and BP, increase the NFP, then increase GFR. Then C, nervous stress, increase sympathetic and constrictions of afferent arterioles, then decrease the blood flow, and of course decrease of the GFR.
Okay, let's summarize what you have answered, no? So these are the mechanisms by which the GFR is controlled. First is autoregulation. That means the body will regulate itself. So if you decrease the blood pressure, there will also
Decrease
be
of
decrease in the
the
GFR,
GFR.
no? So this will also cause dilation of the afferent arterioles, increase the net filtration pressure, and then increase the GFR. So another would be hormonal. So if you
Hormonal.
decrease the BP, because it's only when the BP is increased that you increase the GFR, no? So when the BP is decreased, you decrease the GFR, and this will activate the renin,
The
which
increase.
converts angiotensin 1 into angiotensin 2. Okay, and we all know that angiotensin 2 has many effects, no? Okay, so which we shall find out later. And the third one is the
The
nervous
nervous
system.
stress.
So stress. So we all know that stress can really increase your sympathetics, no? So when your sympathetic nervous system is affected, this will constrict your afferent arterioles. So that means there will be decreased blood flow, and this will decrease the GFR. So if you have good GFR, that means good urine flow, everything is okay. What is tubular reabsorption?
It's a process by which substances are returned to the blood from the filtrate.
Where does tubular reabsorption occur?
Of course, mostly in the PCT, also in a loop of Henle, DCT, and the collecting duct.
Okay. So tubular reabsorption occurs mostly in the proximal convoluted tubule. In tubular reabsorption, what materials are passively reabsorbed?
Water is 99.3% or 178.5 liters per day is passively reabsorbed by osmosis, and the anions or the chloride are passively reabsorbed.
So the anions, the chloride, are passively reabsorbed. So in tubular reabsorption, what materials? So earlier we talked about passive water and the anions. Now we talk about what are actively reabsorbed.
Organic nutrients,
Mm,
99 to 100% are actively absorbed,
yeah. And the
and
cations,
the cation ions or the K
sodium.
plus,
Mm.
sodium, the potassium, calcium, etc., are actively reabsorbed.
Are all materials reabsorbed?
Yes.
What is tubular secretion this time?
The tubular secretion is a process by which substances are passed from the blood into the filtrate.
Where does tubular secretion occur?
Mostly in the ducts and collecting ducts, some in the PCT.
Okay, DCT is distal convoluted tubules. No? In
Distal.
tubular secretion, what materials are secreted?
Exists potassium and hydrogen ions, then waste like urea, uric acid, creatinine, and ammonia.
What is countercurrent multiplication?
Process by which a high sodium concentration within the medulla is established and maintained, which is necessary for production of concentrated urine.
Describe the mechanism of the ascending loops of Henle.
It is the highest concentration at bottom and lowest at top because there are less and less sodium ions or transport as the filtrate moves up, and ascending loop is impermeable to water. Water does not move in.
Describe the functions of the ascending loops of Henle.
It actively transports sodium from filtrate into the interstitial spaces of the medulla.
Describe the mechanism of the descending loops of Henle.
It is impermeable to sodium, but it is permeable to water.
Describe the functions of the descending loops of Henle.
Descending loops. The functions of the descending loops of Henle is water moves from the filtrate into the interstitial spaces by osmosis, thus concentrating the filtrate or the urine.
Yeah, what is countercurrent exchange?
The process by which the high sodium concentration in the interstitial spaces of the medulla are maintained.
Interstitial. Okay. Describe the mechanism of countercurrent exchange.
Descending loops of vasa recta gain sodium and loses water passively. Then ascending loops of vasa recta gains water and loses sodium. And the net result of the blood's osmolarity does not change.
Describe how the urine volume is controlled.
Under the normal circumstances, the urine is dilute, increased blood osmolarity, increases hypothalamus, then increases posterior pituitary, increases ADH secretion, increase water absorption by the collecting ducts, decrease urine volume.
Can you describe the composition of normal urine?
And composition of normal urine is a 95% water, organics like urea, uric acid, and creatine. Then inorganics is sodium, chloride, potassium, and ammonia.
Describe characteristics of the normal urine.
Mm, 1.5 liters per day, light yellow to amber, then transparent to slightly turbid, and aromatic like ammonia if allowed to strand. Then pH 6, 4.5 to 8.0.
Do you have that amount of urine being expelled every day?
Yes, sir.
Wow. Congrats. 1.5 liters per day. What is the function of the ureter?
The function of the ureter. Transports the urine from kidneys to urinary bladder.
How does urine move from the kidneys to the urinary bladder?
Peristaltic waves like every 30 seconds that move the urine into the bladder.
What is the function of the urinary bladder?
The function of the urinary bladder is the storage and expulsion of the urine.
Describe the mechanism of micturition.
Uh, First, the bladder stretches as it feels like 200 millimeter
So
or ml.
the moment your bladder um, is being stretched by
Stretch.
because there is
Uh,
a 200 ml of uh, fluid, then it will yeah,
increase
continue.
the
Increase the stretch receptor.
increase the stretch receptors in walls.
It's
Desires
200
to urinate,
ml.
constriction of the bladder and opening of internal sphincter.
Mhm.
The second is the cerebral cortex. Opens external sphincter, and the third, as a result of the of A and B, urine is forced into the urethra and out.
Okay. So maybe if the question will be asked, how much ml of urine should be present in the bladder for you to have the desire to urinate? What will be your answer?
200,
Yes. How much urine should you excrete or eliminate per day?
1.5 liter.
Okay. So let's start measuring. What are the functions? Oh, you take this seriously, huh? There's so many
Yes.
people that they don't know their kidneys are already not doing okay, no? So let's talk about the urethra. What are the functions of the urethra in male?
Transports urine and semen to the outside.
So it's um the same ano, 'di ba?
Same from male and female
No, for the urine, it's the same, urine and
for the
semen.
urine.
So when the
Uh,
semen will also pass through the urethra as well as the urine to the outside. What about the functions of the urethra in
the
female?
bladder. The transport urine from the bladder to the outside.
Wow, congratulations.
So the difference between the men and the male and female, the male transports urine and semen, then the female is transports urine from the bladder.
Okay. Now let's go to anatomy. Which number indicates a major calyx?
Pointing number 2.
Which number indicates the renal capsule?
Renal capsule. Pointing number 4.
Okay, what is number 6?
A kidney.
Same question. Which number indicates a... Number 8 is...
Pointing a ureter.
Okay, what about number 10?
Number 10 is the renal cortex.
Number 14.
The number 14 indicates the urethra.
What about number 12?
The renal artery.
Okay, where is the ureter? What number?
Pointing number 8.
Number 2 is...
The major calyx.
Number 16 is...
Number 16 is the abdominal aorta.
Aorta.
Aorta or aorta.
Aorta. Which number indicates the renal cortex?
Pointing number 10.
Number 4 is...
Number 4 is the renal capsule.
Okay, what about number 18?
Number 18.
That's the urethra.
That's the urethra.
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 Which number indicates the renal artery?
Pointing number 12.
Number 1 is...
Number 1 is the minor calyx.
Number 5.
Number 5. It's a renal column.
The renal pelvis is what number?
Pointing number 11.
What about number 3?
Number 3 is the renal medulla.
Minor calyx is what number?
Pointing number 1.
Number 7.
Number 7 is the inferior vena cava.
What about number 9?
Number 9, the bladder.
A renal column is what number?
Number 5,
Number 11 is...
the renal pelvis.
Number 13.
Number 13 is pointing the renal vein.
Renal medulla is what number?
Renal medulla is pointing number 3.
Number 17.
17 is the ureter.
Inferior vena cava is...
Inferior vena cava is number 7.
Yeah. So what is 16? Abdominal aorta. Diba? Katabi niya si inferior vena cava or inferior vena cava. What is number 15?
Number 15. The adrenal gland.
Yes. Bladder is what number?
Bladder. Number 9.
Where is the ureter? What number?
The ureter. Number 14. Ureter.
Renal vein. Renal vein.
Number 13.
Okay. Adrenal gland.
Adrenal gland. Number 15.
Abdominal aorta.
abdominal aorta is pointing number 16.
Ureter, what number?
The ureter is number 17.
Number 14 is,
Number 14 is the ureter.
okay, what number is the renal capsule?
The renal capsule is a number 4.
Renal medulla is what number?
Number 3, renal medulla.
Which number is the urethra?
Urethra is pointing number 18.
Number 16 is,
The abdominal aorta.
okay, what about number 18 again?
The urethra.
Yes. Major calyx, what number?
Major calyx. Number 2.
What about number 15?
Number 15 is the adrenal gland.
Number 17.
Number 17 is the ureter.
Okay. Minor calyx is what number?
1.
Okay. Thank you so much, Sir Rodrigo.
Thank
Good
you,
luck on
Doc.
your very lucrative business. Very good job.
Thank you, Doc.
Excellent job. Thank you. Now let's call on Sir Harold of
Doc,
Cebu City. Good afternoon. Let's start.
ano, Doc?
Let's review the physiology of the urinary system.
Okay.
These organs is not part of the urinary system.
The pancreas.
Which substance do the kidneys filter to produce urine?
Wait sa Doc, the blood.
The bladder expels urine through which passage?
The urethra.
What is the function of the ureter?
Ureter. Transport urine to the bladder.
What function does the bladder serve?
Hold urine before it is excreted.
So siguro you have seen people who cannot hold their urine. Okay, in Chinese medicine, the ability or the capacity of the bladder to hold urine is determined by the strength of the kidney. So if you have weak kidneys, you cannot hold your urine. So you need to wear diapers. Now you know. So it is very important that we take care of our kidneys as early as possible. What causes the high blood pressure in the glomerulus?
Diameter of the blood vessels decreasing.
What are the specialized filtering units in the kidneys called?
Nephrons.
Which hormone increases water reabsorption in the kidney?
The antidiuretic hormone, ADH.
So this is the one that will not make you urinate. So that's why it's called antidiuretic, no? To increase water reabsorption, especially if you are dehydrated. How many kidneys does the body have?
2.
Urea is made from excess blank in the diet.
What number yun, Doc? Limot ko. What number na, Doc? Number
Number
10.
10.
Wait. Amino acids.
Okay. Where is urea produced?
In the liver.
So now you could see the relationship between the kidney and the liver, no? So if you have weak liver, then you will have a problem. Where are the kidneys located within the body?
under the ribs at the back of the body.
Why does urea need to be removed from the body?
It is toxic
So you need the kidneys to remove it, right? Why is the bladder elastic in nature?
to allow it to expand and hold more urine.
Okay, what volume of urine will make you in the bladder will make you want to urinate?
Mm.
Hala? Ganiha, 200 ml.
Okay.
Agree?
Depend.
Yeah. How much urine should you excrete or expel every day?
1.5 liters.
Okay. As well as water, what two substances are also reabsorbed into the blood?
Salts and nutrients.
Antidiuretic hormone is released in the body when there is
Decrease blood volume.
yes. ADH is produced by
The pituitary gland.
antidiuretic hormone increases water reabsorption by
Increasing the distal tubules permeability to water.
which blood vessels supply the kidneys with blood?
The renal arteries.
Blood from the glomerulus filters into which structure?
Bowman's capsule.
The Bowman's capsule drains into which part of the nephron?
The loop of Henle.
Where in the kidney does the reabsorption of water occur?
The loop of Henle.
Dialysis is the
Artificial filtration of the blood through a machine.
a kidney transplant might be needed due to
Complete loss of kidney function.
filtered blood leaves the kidney via which vessel?
Renal vein.
During periods of low hydration, urine would be
More concentrated.
during periods of high hydration, urine would be
More dilute.
one negative aspect of dialysis is that
Being connected to a machine is an invasive procedure.
name one negative aspect of receiving a kidney transplant.
Uh, Immunosuppressive drugs must be taken.
Name one positive aspect of receiving a kidney transplant.
It allows the receiver to pursue a normal life.
Wow, congratulations. Very good job. Thank you so much, Sir Harold.
Thank you.